Hi, I'm Dr. Carl Wierks. I just wanted to give you an introduction to your physical therapy after hip arthroscopy. We've worked with physical therapists closely to develop a very specific plan for you. The purpose of this video is to demonstrate some of the initial exercises that we recommend the day after surgery so that you can educate yourself and have somebody help you or show the physical therapist in your area which exercises we recommend doing.
After your hip arthroscopy surgery, you'll be performing a set of exercises 2 times a day. To perform these exercises, you'll want your patient on a firm surface. At home, you can use a bed or another surface that is most comfortable for both the patient and the caregiver. When the patient lies down, it is convenient for them to hook their uninvolved leg under the surgical leg to make it easier to lift the leg up and down off of the table. The first exercise that will be performed is going to be on the surgical leg, and it is internal rotation, range of motion. The patient will be lying on their back, keeping the leg relaxed. The caregiver will place one hand on the knee and the other at the ankle. Slowly rock the patient's leg inward and then rock back to neutral. Make sure the leg does not rotate outwards. You're going to repeat this motion in a slow, continuous motion for 5 minutes. The next exercise is circumduction with the legs straight. The caregiver will ask the patient to move slightly down towards the end of the surface. It is easiest if the patient's heel is slightly off of the surface and closer to the caregiver. That will eliminate any back pain to the caregiver. The patient will continue to lie on their back, keeping the leg relaxed. The caregiver will hold on to the leg at the ankle with the fingers interlocked. Slowly begin to rotate the leg in a circle in a clockwise position, making sure the leg stays straight. After 5 minutes, you will slowly stop and change positions to counterclockwise. Continue the circles for 5 minutes. Again, be sure that your patient is relaxed and is not helping with this exercise. It should be a passive movement. After 5 minutes has passed, you will have done this position for a total of 10 minutes, 5 minutes clockwise and 5 minutes counterclockwise. The next exercise will be circumduction with the patient's leg in a flexed position. The caregiver will carefully lift the patient's leg up to a 70 to 90 degree position of hip flexion, and the ankle will be on their shoulder. In the beginning, it will be painful to bring the leg fully up to 90 degrees, but as the patient recovers and pain decreases, you can increase the amount of flexion. Place the hands just below the knee and then begin to slowly rotate the leg in a clockwise position. Again, this exercise will be performed for 5 minutes. It is important for the caregiver or therapist to rock with the leg to prevent back pain. After 5 minutes has passed, you will slowly stop and reverse directions and perform circles counterclockwise for 5 minutes. After 5 minutes has passed, the caregiver will take the patient's leg and slowly lower it back down. Be sure to do this in a slow motion as to not cause increased pain for the patient. The next set of exercises will be 3 different isometric exercises. There will be minimal movement with these exercises, rather you'll be tightening the muscles. The first one is quadricep sets. With the patient continuing to lie on their back, you're going to tighten the quadricep muscle, which is your thigh muscle, by pressing the back of your knee flat. Hold the contraction for 5 to 10 seconds, and then relax, and repeat this exercise 10 times. After 10 repetitions, the next one will be gluteal sets. The patient will continue lying on their back and tighten the buttock muscles, holding tightly for again 5 to 10 seconds. This will also be performed 10 times. After 10 repetitions, we'll move on to the last isometric exercise, which is the transverse abdominal sets. The patient will continue to lie flat on their back and tighten the abdominal muscles by trying to press the back flat against the mat or bed. Again, hold 5 to 10 seconds and repeat 10 times. These exercises, which include the range of motion exercises by the therapist or caregiver and the isometrics, will be performed twice a day from day 1 post-surgery through 21 days. If the patient goes to therapy, that may count as 1 time per day, but will still need to be performed 1 more time at home.
Thank you for watching this video. We hope that it was helpful and educational for you, and if you have any questions, please don't hesitate to give us a call.